Today, we are covering the top 10 questions employees have during a pandemic. And I am thrilled to be presenting today with my HR director, Danielle Bearden. To give you a little background about us, we are part of a company called Lever1, and Lever1 is an HR outsourced company. We have over 120 local businesses that utilize our services, and we employ over 3,500 worksite employees, or provide HR services to over 3,500 employees. And so today's information is going to be drawn from the conversations we've had recently with those employers and prospective employers and contacts about the challenges that employees are facing during a pandemic. So we want to share with you today what is on the minds of today's workforce, and hopefully as an employer give you a good understanding of what's going on with your employees as they face the same challenges that we all are facing through this pandemic, but more importantly, how they're going to feel about the job they have with you, your coworkers, returning to work, potentially caring for people, children out of school, or family members that may be ill, and a whole gamut of scenarios that we have seen play out during this last 2.5 months. So we thank you so much for joining us today, and excited to have you here. There is a chat feature that I will be monitoring. So if you toggle over your control panel and you want to pull up that chat, you'll see the ability to post questions, and I'll be monitoring. So feel free to jump in with questions as you have them. And also we will have more information about upcoming seminars on that chat as well. So feel free to be utilizing that through the presentation. We will also have time for questions at the end. Danielle, would you like to introduce yourself?
Yeah, thank you. We are eager to be here, to be a part. Again, we are from Lever1, in Kansas City based. However, we have clients in 44 states. So as we have muddled through this journey and pandemic, along with a lot of you, we are just leaning on one another and caring about one another as we get through. But my name is Danielle Bearden. I oversee our Lever1 HR department here. I have experience with over 15 years worth of wonderful HR aspects and labor relations, employee benefits, you name it. But really excited to be here to kind of lend an understanding to both the employer and the employee throughout this time and circumstance. It's certainly an unprecedented one, and one in which we have had the opportunity to lead and educate our clients and staff for the past 2 months. We do lead at Lever1 the COVID-19 task force, in which we stay up to date with the CDC, local state ordinances, guidelines for our clients and in those 44 states in which we operate. So again, we welcome any and all questions that you all may have, and we're happy to be a part today.
Thank you, Danielle. We are going to jump right in with the questions that we are seeing most prevalent from employees and employers. And the first one, very obvious: I'm afraid to go back to work. What are my rights? And fear is the one thing we all have in common working through this pandemic. Different levels, and it manifests itself in different ways, and everyone has a different level of comfortability, but we can all say, you know, unanimously that there is some level of fear within all of us. So what exactly are you seeing as the rights that employees and employers have specific to this pandemic, Danielle?
Yeah, so this is a very common one. Look, your employees are fearful, and so they want to know, if I am recalled back to work, do I have to go? And what are my rights? And First and foremost, we want to bring attention to the Families First Coronavirus Relief Act, otherwise known as the FFCRA. This was one of the first acts to come forth from the government to give extended leave and sick time considerations to those individuals who might fall under certain qualifying criteria, such as have children or dependents in which childcare is unavailable. Maybe they're experiencing COVID-like symptoms, which we know are ever growing as well. Maybe they are caring for someone who are undergoing symptoms, or maybe there's another stay-at-home order that still has not been lifted in the municipality or the state in which that employee is. If, for example, you reach some of those qualifying criteria underneath the FFCRA Act, you would be protected. So if you are recalled back to work and it's an essential business or not, you may be protected under that specific act in which we've talked about briefly there. And then that would award you, so to speak, with anywhere from 2 weeks to 12 weeks of protection for your job under the FFCRA. But also, when employees ask, do I have to go back? The kind of the short answer is yes, but with caveats, right? So to be respectful and know that you will need to communicate and be collaborative and explain what the workplace is doing to uphold their safety standards for that employee. But let's say we do state the OSHA Act here, which talks about, and we've had a lot of these questions from employees, do I have to return? I think this is an imminent danger or a heavy contracted or disease area. What we're saying there is the OSHA states that you have to prove that you're in imminent danger in order to be covered under that Protection Act, meaning that death will occur or a serious illness may occur in which would be the direct result of you returning to the workplace. Another consideration that we like to see in how we work through these worried employees returning to the workplace would be under the ADA Act, or the Americans with Disabilities Act. We are aware, and I'm sure a lot of you are as well, that there are individuals who are considered high risk from the CDC in different categories. And so what we have seen as we are reopening America and reopening the workplaces are to do so in phases, right? And so if you tend to be an individual who may be at high risk of contracting, you may be able to have special accommodations under that specific act so that you can remain safe, possibly still telework if the employer does present that option as well. But those are the few that we're seeing as far as, if you're afraid to go back to work, what would your quote unquote rights be? And those particular acts are what we're seeing as we navigate through.
So Danielle, I see a lot of employers do a survey. They've sent a survey to their workforce, and half are excited and eager to get back in the office, and the other half have some reservations and would prefer to still work at home. So it really seems to be a case-by-case basis is what you're saying, where I need to assess, am I in an environment that possesses imminent danger? Well, no, I'm in an office space, which I think most of our participants are. And so it's not one of those factories that has had outbreaks that have been, mandated to shut down. So I'm in an office and I have, 20 employees, and 19 are willing and eager and ready to come back on our restart date. But one says that they're just not comfortable. They don't have an ADA, that we're not in imminent danger. What do I do with that one person?
My first answer is going to be to remain as flexible as possible. You know, I think at this time, you have to take it by case basis where you can. And that's given that the employee is not considered maybe an essential employee, or the business operations would not be adversely affected with that employee not returning. So twofold there. You know, if the employee is absolutely essential and there's absolutely no flexibility, and I think that would be a different answer to consider. But in most cases, there is an opportunity to try to be flexible with that employee. Everyone's circumstance is way different. And we want to really exude that advice to our clients as we navigate through day to day. Be flexible where you can. If you can afford to extend certain time off, or be able to loan time off, or maybe they would fall under the qualifying reasons for leave. Really take the time to be collaborative and speak to the staff one-on-one, so that we understand where we're going. Can they work part-time? Can they telework? Lots of different options, but flexibility is going to be the key, and on a case-by-case basis if they're not an essential part of the organization.
And these qualifying reasons that we have up on your screen are directly from the Department of Labor on this Families First, the FFCRA Act. So as Danielle mentioned, if they qualify for one of these, you want to identify it, because you can then pay them for this paid leave and receive credit back for that total amount through a payroll tax credit. Many employers still don't understand that this is relief for the employee who is suffering for many of these number of reasons, but it's also relief for the business owner to not go out of pocket on paying this paid leave. So it really is a win-win, and we are seeing that across the board. So again, if your employee qualifies for any of these, whether they are under self-quarantine, caring for someone that's ill due to COVID, caring the child care issue for people whose daycare may be closed or schools may be closed, and the list goes on here. But these are advantages that you have as the employee and the employer. And so starting here is really a win-win. You do need to work with your payroll provider to obtain those credits, but you get the credit at the same time that you're paying out the employee. So we are able to process those here, and I don't know about every payroll company, but you do have the ability to process this, so you are not out of pocket at all on this if someone qualifies for these paid leaves, which is a huge, huge benefit. The bottom line on fear, which is what this first question relates to, is technically fear is not a qualifying event. So if someone does not qualify for any of these government paid leaves and they truly are just fearful, our advice is to work with them as best you can, to have a deep understanding on options and open communication, and we are seeing that play out successfully in most cases. All right, well, that's a long one. We'll move on and go a little quicker from here on out. Okay, question number 2. My employer doesn't need me right now. What type of unemployment and benefits can I get?
Yeah, all right. So this has been an ever-changing one as well, but with this, it is going to depend on the state in which you worked in, right? And this does differ by each state and each organization. But if you are not being recalled back and you're still out of work, under the CARES Act, which was a second provision and passed as we moved along throughout this pandemic, and it expanded unemployment availability in multiple different areas. One in particular, to those individuals, it allows an extra $600 a week, those qualified individuals, I should say, through the end of July 2020. That is in addition to the unemployment compensation benefits in which you may qualify for besides that. So that's in addition to that. So there is a weekly calculation in which each state figures differently. It asks the employee to report weekly any wages in which you've earned or have not earned. Under the CARES Act, it is available to those independent contractors or 1099s as well. And each state in which we've seen has a specific spot to log on and look at COVID-19 resources. And I know we've gathered quite a few, but what we're finding is most states will have a packet specifically pertaining to COVID-19, how the applicant needs to apply. We've seen a lot of some technical difficulties with some websites in the different states in which we operate out of. But that was just because of an overabundance of people going in to apply for those benefits. There are additional federal payments in which you've seen the first stimulus check go out for individuals who have filed, as well as COBRA. COBRA keeps benefits intact for a certain amount of time, allows you to have them with a qualifying life event, such as losing your job or being just out of work or furloughed. But essentially each state is very different, but those benefits can be available to you. You just have to make sure you go on this specific state you're looking at and make sure that you've read the application in its entirety and completed it as they wish, because sometimes just one little incorrect field or mishap or oversight would reject it back. But as far as the unemployment compensation under the CARES Act, it has quite expanded the availability of benefits that you could qualify for.
I will also add some pitfalls that we have seen as we process hundreds of unemployment applications that get mailed to us is you need to request unemployment in the state that you work. Some of us work in Kansas and live in Missouri, or vice versa, and there was quite a bit of confusion and misfiling. You picked your lived-in state, filed, waited, and got denied. So you need to pick the state in which you most recently were working and laid off from for the filing. In addition to those facts Danielle mentioned, we had a long conversation with the Missouri Department of Labor Unemployment Division, and they said that 99.999% of the questions that you're trying to call in or email in are on that FAQ sheet on their website. So to really start there with your questions, because there is 99.9% of the questions they get, it's black and white on that FAQ. It's very lengthy and has all the questions there. So yeah, those are some tips we are seeing.
I would also like to know, and I forgot about this one, I think it's important. We have seen an influx in individuals simply not wanting to go back to work. Let's say they are recalled, not wanting to go back to work because they're making more money on unemployment. While we understand that, just make careful note and consideration that those purposes may be considered unlawful. And so we really make special consideration to explain the recall process and the reasons in which that process and policies are in place there.
Great information. When you're doing your unemployment application, there is a toggle where you mark the reason why you are unemployed, and COVID-19 is an option and is likely the right selection for you. You could have also been laid off for some other reason, but the majority of the people we're seeing need to toggle the COVID-19, and that will help expedite your application. And to elaborate on what Danielle said, the Department of Labor was very thorough on staying on unemployment. To stay on unemployment is unlawful when you are re-offered your job back, unless you again qualify for one of those leaves. So you know, we just want to make sure that that you understand that as well. And that's a very difficult situation, especially for those employees who may potentially be making more. All right, let's move on to the next question. My office is reopened, but I still don't have childcare. What are my options?
Yep. So again, this is going to fall under the FFCRA, in which we briefly chatted about. In most cases, this will. What it does is, for those employers with fewer than 500 employees, it offers 80 hours of paid sick leave under the FFCRA, of course, for qualifying purposes such as childcare is unavailable. And then there is the expanded FMLA, which says, okay, on top of those 2 weeks of the sick pay, we're going to offer you 10 weeks of paid leave to be able to care for your son or daughter whose school or childcare is unavailable. So those are the first and foremost options that we see under the new FFCRA. Of course, we can get into more complex situations, and each circumstance is very different. But the overall message here is to still remain collaborative, talk to your employees, talk to your managers, and know that your options likely will be covered under FFCRA, broadly speaking, but every circumstance is very different.
We monitor all 50 states because we operate in every state. I have not seen anyone update Kansas or Missouri for schools reopening in August or September for the fall. I did see, however, last night, the governor of Ohio, the first state I have seen, issue that they do plan to reopen schools in the fall. It was a generic statement, but they are planning to do that, and that they are allowing each school district board to determine what date that will be. So that was the first sign that schools potentially will open in the fall. Obviously, that is a huge concern. And when we talk about the anxiety and the fear of going on with employees, they have maybe figured out the care for the summer, or maybe they have this 10 weeks provision right now, but what happens come August? What happens in September? Both Danielle and I tried to do distance learning. We have children at home, and this is going to be very, very difficult if we are not at a place where children can return to school mid and early August in some cases. So we are keeping our eye on that. Like I said, Ohio is the first that I saw last night to declare they, as a governor and as a state, they are allowing the reopening, and then it will be up to each individual school district. So we anticipate every state doing something different. So that'll be interesting to navigate. All right, next question. What can my employer do concerning my health? Typically, we have HIPAA and a lot of protections in place regarding employees' health. And I frequently encourage employers to not direct the employees to the HR professionals if you have them on staff when you have questions about specific health conditions. But during a pandemic, it's actually different. So Danielle, what can an employer do now that we are officially deemed in a pandemic?
Yeah, absolutely. So it used to be that we would say, no, don't take those temperatures, don't do that, because that's information we wouldn't otherwise be privy to. But the EEOC came out with some changes in guidelines saying that, hey, during a pandemic, you legally can, as long as you keep it confidential and consistent in your approach, right? So that kind of opened up a new way of thinking, especially for different workplaces. But employers can ask you to take your temperature, making sure that you're free from one of the symptoms and before entering the workplace. What I like to say about this one, though, and my heat of caution here, is that if you are choosing to do this and practice this approach, be sure to communicate to the workplace and staff that this doesn't mean the workplace is free of all communicable diseases just because you're not seeing the one symptom, right? And important to make note of that. But it is okay for employers to want and ask you to take your temperature upon entering the building. We have also known that there is a requirement to wear face masks, and some organizations have chosen to do that, and they can, and that's okay, as long as it's done so consistently amongst all staff. We've seen waivers of liability come on from different workplaces and questions about those. Um, Different employers will ask, well, you know, hey, can I have this waiver to say that you understand that by coming into the workplace, your risk is going to be higher because you're ultimately around people and away from your home. Um, you know, I can't speak from necessary legal standpoint on that, but there are those questions and those templates out there, and we have seen waivers of liability that the employer will ask the employee to sign, kind of saying, I understand my risk and I'm willing to take it. Remote working is another option in which I know we've all been through these past couple of months as well. Screening programs is just one in which you're asking your staff and the staff members you are choosing to answer that you are symptom free as far as you know. You haven't traveled to certain areas in which you're at higher risk for or outbreaks of, and you're doing this before you're entering the building. So participating in the screening programs is an extra step that the employer takes to safeguard their workplace, but also that the employee takes to do their part in preventing the spread too. Employers can limit your face-to-face meetings. For example, we've seen some return to work programs in which, you know, you're recalling your staff back maybe in phases, phase 1 and phase 2. We've seen that still face-to-face meetings are very limited. We still want to encourage social distancing, really utilize your technical resources as well, and virtual Zoom meetings when possible. Symptomatic staff can be sent home. I've seen a really firm stance on this, and we just continue to encourage the following of CDC guidelines. But we do understand too, the COVID-19 symptoms are ever growing on the CDC website. And so just be aware and continue to using some of these resources before employees go into the workplace certainly shows your care and compassion, as well as the employees to want to do their part. But lastly, the employer can shut down operations temporarily, right? Like if they're fearful of an outbreak or they're fearful maybe someone was exposed and maybe your social distancing wasn't well, or maybe they were in close contact with an individual, they can temporarily shut down operations in a specific area. Maybe that be for the business as a whole, as they follow the proper sanitation and disinfecting guidelines from the CDC as well as OSHA.
It's really interesting. We have had employees come forward saying, hey, I cough because I have asthma, or I sneeze. I have very strong allergies this time of year. I don't have COVID, but I just want to let you know that I have these symptoms and I don't want, you know, the people around me to be fearful, which is so interesting because typically those would be things to not share with your employer, but now people are sharing those so that everyone in the workplace is comfortable.
Yes, and in particular, asthma. The CDC came out with a whole separate asthma resource panel and page for those individuals suffering with that. But this now is the time where communications are completely upped and transparency is way important. But yes, the asthma, allergies, all of that, important to work with that employee and really understand where they're at.
Very good. We have seen this a lot. Do I need a doctor's note to return to work? Or from the employer's perspective, should I mandate a doctor's note so that I feel comfortable allowing someone who had been exposed or who had been sick back into my workplace?
Yeah. So this was a new one too for us, because before this, pre-pandemic, we would want a fit for duty release, doctor's note, and we'd apply that policy consistently, right? And that practice. But before now, we were, yes, that is what we do to make sure the workplace is safe. And then all the physicians and healthcare providers became just crazy, overwhelmed and busy with this whole pandemic. Then it became the new guidance was employers shouldn't ask for a doctor's note at this time in the pandemic for the employee to come back to work. And that was new, I think, for us all to swallow and kind of figure out then what. But it's just important to know that you can still require it from a healthcare provider to return to work. It's just understanding the attainability and the realistic and practical way in which your employees are going to be able to get this. The CDC did suggest employers to remove that requirement because it just may not be practicable in the crisis in which we were in or are in. If you do decide to require it, do so consistently. Do keep in mind the hurdles in which employees may have to overcome and the challenges to and able to get that. But if the employee does decide upon, or employer on doing it and getting a doctor's note, and they're working remotely, there are other options to consider. Like the employee can send the image of the doctor's note rather than bringing it into the workplace. They can send an email, they can scan the image of the doctors can fax, they can send an email themselves. Lots of different options there, but the short answer is yes and no, unfortunately, in the middle of the pandemic. But if you do require it, in which you can as an employer, you must do so consistently.
So if somebody is self-quarantining because they've been exposed, they would not have a note necessarily to come back. They just did the quarantine. If they went and got tested somewhere, now that there's more testing available, again, we're not necessarily needing their negative test results. They can share it or whatnot, but so that's interesting. We're really going a lot on employee accountability to make good and smart choices. Obviously having the employer have a good policy in place as well to say, hey, if you've been exposed, if you feel sick, go ahead.
Right. And this just adds another spotlight on the importance of being collaborative and always having that communication so that you know and the employees feels comfortable speaking with their supervisor and vice versa.
Okay. All right. What if it's not allergies or asthma, I was at the Lake of the Ozarks, or I have a high fever, what am I supposed to do?
Oh, goodness. Well, I put first on here, don't report to the workplace. Know that in most cases here, your employer is going to want to err on the side of caution to not only protect you, but to protect the workplace and the other staff members. We're going to say call your health service provider as soon as you can. Let them be able to give you the proper evaluations and instructions on what to do, especially if you believe you've been exposed. We ask that you disclose this to your provider. The CDC has a wonderful portion in its website that helps you to track your symptoms. It is electronic and it's like a questionnaire. And they also update their guidelines on how to consider your risk level. And it is kind of like a grid in which you can follow. And so we always recommend, if you haven't logged on to the CDC website or you haven't incorporated following their updates, do so, because it's so helpful to help get through these times. But, and realistically too, if you have an emergency sign, like if you can't breathe, or something of that nature, we're going to ask that you get emergency medical care immediately. But if there's a resounding message, log on to the CDC, sign up for their updates. You can see them, and they will email you every day with what's changed from day to day. But the first, contact your health service provider first and foremost.
I would also add, let your employer know you are seeking diagnosis. You are seeking, whether they test you or will test you in the future, you've reached out to the doctor and you're seeking a diagnosis, because that is one of the criteria to be covered under those paid leave provisions. That's a benefit to you and it's a benefit to the employer. So like, I know that's a change. Typically, again, we don't talk about our health conditions with our employer, but in this case, when you are seeking a COVID diagnosis, just even if you just have a fever for the first day, or any of the symptoms that is a long list, don't be fearful to inform your employer, because there are those paid leave provisions available to you.
Oh, that's a good point too. And I want to add to that, you know, some responsibility that's put back on the employee is you still have to adhere to your company's punctuality and attendance standards and your normal call-in procedure. So that's still here and important to note. So thanks for bringing that up.
Okay, what are some tips to consider for my mental well-being, right? So now we've reopened and people are back at work. People seem to be out. The sun is out. If summer is here. What are some tips on the mental stress and anxiety side?
This is a big one too. And people have been through a lot. We've been through a lot, and keep that compassion on the forefront of your thoughts. If I can give any advice to this too, but the mental well-being is a huge one. This is going to affect how your employees operate, and you as an employee are productive. And to be honest with yourself and the employer on what you feel that you can handle versus what you can't handle. But the first tip I'm going to throw out there is to keep a routine. So this was hard for me in particular when I first started working from home, because I'm like, well, I guess I'll put on makeup today, or maybe I won't, or maybe I'll get dressed from the top up, you know, and all fancy. But keep a routine as much as you can, especially in maintaining as much normalcy as possible. So if you did wake up at 6 a.m., you got ready for work, you got yourself dressed, continue to do those normal things. It'll make you feel good. It'll make you feel better. And people who have children at home and caring for them, put them on a routine too. This will not only help you, but it will help them. Getting a good night's sleep is certainly a big one to kind of get all of those worries, those stresses, those anxieties. It goes hand in hand with sticking to a routine. I think it's probably easier if you're at working from home to sleep in later, to stay up later. So it goes hand in hand with the routine, but try to stick to your typical night pattern and sleep schedule, just to have that overall good effect on your well-being. Spend time outside. We've seen this a lot from our resources, as far as focus on your mental well-being. Unless, I should say, health officials have explicitly asked you not to. The sunshine does a world of good. Being outside, what we know is also it promotes higher levels of vitamin D. People are deficient in vitamin D, their mood goes down, their energy levels go down. Really soak up some of that sun, and that would be a great way of doing that. Leveraging the power of technology. And what we mean here is, okay, so you can't be necessarily in person with your loved ones, your coworkers, your staff, your management. Leverage the power of technology. Use those Zoom meetings to see familiar faces, right? Use your phone to connect, to still connect. FaceTime. Feeling lonely is common. And what can you do to bypass that? And I think fortunately, so many advances in technology have made it way easier and at our fingertips. Don't obsess over the news. I'm a big news person myself. I watch it religiously every morning, every night, and I was just watching and watching, and pretty soon I'm like, all right, I gotta take a break, right? Like I have to disconnect. Sometimes the news is a lot of bad things. Sometimes it's good things, but don't obsess over it. Take time for yourself. Maybe pick up a new hobby, or just focus on maybe summaries of news articles without divulging in a lot of the not necessary need to know information. And then lastly, is to practice positivity and gratitude. And I think this just takes time for the individual to sit back, take a breath, realize there's still a lot to be grateful for. A lot of us are we're still here, we're still operating, special people in our lives, and really take time to do that every day. Maybe set a timer to allow for your moment of positivity or gratitude. We have several partnerships with different resources in the area that really allow different options for employees and employers to make a point to take care of yourself. And I think that's the message we want to send here, is that overall, you have to take care of yourself first. There's no one else that will, right? And so take this time to make sure you're well.
I would say from the employer perspective, one of the lessons I've learned as we're working remotely, and we do have a following session that's going to talk about engaging the remote workforce. So I hope you join us for that. But you cannot over communicate during this time. You can say it once and the comprehension is just not there. Everybody is on an information overload. So communicating regularly with your staff about the workforce and your care and your policies for helping them work through this time, whether it's remote, part-time, layoffs, etc. I cannot encourage you enough to over communicate with your employees, as well as adding in that I will listen office mentality, where people feel comfortable telling you they went to the doctor. People feel comfortable telling you my kid is at home driving me crazy and I don't know what to do. When you create an atmosphere that's receptive to that information, you're going to have positive outcomes because employees are truthful. I know some employees in my office don't feel comfortable coming to me, and I know I can see them, their phone is blowing up, there's stress and anxiety, they're all over the place forgetting simple tasks because they have so much stress and anxiety going on. And we can't take that away right now as an employer. We can't take away kids being at home and people being fearful of getting sick, but what we can do is create an atmosphere where work isn't pushing down on top of that. They're going to be more productive at work if they're not fearful that they get a call from their child or they get, and so it's a shift in culture where we are accepting, understanding, and having that I will listen mentality will, I promise, generate the same or better performance results. And typically you think the opposite, but more important now than ever is to create that environment where people can be transparent with what's going on so that they can feel comfortable and safe at work and getting the work done that they're able to do. All right, I'm worried, we're gonna keep moving on here. We got about 13 minutes left. I'm worried about COVID-19. How can I feel better about returning to the workplace? And this goes hand in hand with what we were talking about.
Yeah, it does. It does really. Communication, as you had said, Erica, communicate frequently. We know that they're fearful, but give periodic updates as much as you can on what you're doing to keep them safe. What practices are you taking to keep your hygienes up, to keep your workplace sanitized, disinfected? Lack of communication sometimes has the ability to make employees feel like you are withholding information from them, or they're unsteady, or they don't know what's going on. Don't let them get that far. If you have no information to share, share that you have no information to share, but that you're still taking the precautions from the CDC and making it safe, and that overall you care about them, and showing that level of compassion there. Ask about available benefits. So important. And I will get into this in a later slide too, but there are certain benefits available with some companies, such as an employer assistance program, which offers a complimentary certain number of visits with a counselor or therapy. Many employers also will make sure to offer telehealth programs along with their insurance carrier so that you don't have to get up and go, and if you're fearful of being on site at the physician's office or health service provider. And then a lot of the health insurance providers are now offering COVID-19 testing. And what does that look like? And is it available to you? All good and healthy questions to ask about your benefits. Supporting each other in the workplace was a big one as well, just to keep making sure that you put one another first, care about one another, and also ask about the proactive measures your employer is taking. That's okay to ask. We hope that, we don't want to have them ask because we want to have that ongoing communication, but it is okay to ask if maybe you didn't catch something or maybe you want reassured. We've given the guidance of a healthy return to work program for employers to take. This outlines what the employee can expect coming into the workplace, what you're doing to keep them safe, and everything in between.
All right, and so to tee up on that, what is the Employer Assistance Program and who does it benefit?
Yeah, so an Employer Assistance Program, in which we call an EAP for short, it's an intervention program that's designed to assist employees with a lot of different things, but such things as maybe personal problems, marital, financial, emotional stress, family issues, substance or alcohol abuse, just to name a few because it's not exhaustive. They offer a wide array of services. Some will help in legal assistance or referrals, adoption assistance, wellness programs, and they're complimentary. They're a wonderful, wonderful resource, and I can't stress enough to ask if your employer does have this option, and if you are an employer, to look into offering it if you don't already. A lot of clients have come up the reins with wanting to offer this to their staff. Every plan is a little different. Some might offer maybe a complimentary 3 sessions annually for a staff member who might be experiencing emotional stress or anxieties, as an example.
Okay, fantastic. Okay, and this is our last question on the slides is, can I trust using that? And we keep talking about how, you're able to share your medical situations now. It's a whole different environment, but I don't know that I want to use my employer's service to vet my dirty laundry. How can you assure me when I contact HR, when I contact one of these benefits and services, that my information will be confidential and not shared with my employer?
Yeah, and really important, especially too for those who might be experiencing some mental anguish and emotional issues. Very often people won't want to necessarily share that openly, and they're just looking for an out. And it's important to know that the most critical part of this EAP program is confidentiality. So it requires it when it comes to alcohol, drug abuse records, and it does provide penalties for unlawful or unauthorized relief. So it's completely confidential. What you're sharing with these different therapists and counselors along the way. And there are a lot of regulations to make sure that all of that stays in line. And EAPs won't release information without a signed consent, regardless of the nature of the problem. So it's a safe place to land.
All right, well, that brings us through our top 10 questions. We do have the chat feature, and I would encourage you to post additional questions there. We do have a few minutes to answer them. In addition, we are conducting additional webinars that dive deep into some of these individual topics, such as remote working, the paid leave, and how to, as an employer, get the tax credits for those, and on and on. And so you can find that information. I'm going to move one more slide here at this link, this Eventbrite link for the Women's Business Center. And I'm going to leave this slide up so people can write that down as we're answering questions. It is also now posted in the chat button, so you can click right onto it and get yourself signed up for these complimentary webinars that the Women's Business Center is conducting on their Women Wednesdays Entrepreneurs Series. Danielle, I had a couple questions that I answered on unemployment, such as when you work in both states. My response was, which state do you file in? What we have found is that your employer typically only pays into one state, the unemployment wages. And the state, when you file, is looking for that. They are looking to see that you are eligible for unemployment based on your previous employer. So if you could look at your W-2 and see the state that's listed there. You could also call your employer and ask if you're unsure, but typically it's the state where the employer is located if you're bouncing around town. You don't want to get this wrong, because you're going to go, we've seen people go weeks waiting and it's not the right state. So make sure to check with your employer to understand which state they filed in. Also, if they are a 1099, which is very new to unemployment, and the 1099 people I talk to, sole proprietors who are able to file for this unemployment relief for the first time ever, were much more delayed in getting their funding. Danielle, my advice on the 1099 situation is to file from your home, assuming you don't have an office and are not filing W-2 wages. If you're a sole proprietor, then you would be filing based on your home address, where you also file your income taxes. Again, they're trying to just correlate the two there.
Yeah.
You agree with both of those? I put those answers in there. Okay. I have another question, Danielle. Does my employer already have the info about the benefits you listed for COVID? How can I make sure they are aware of it, especially time off work for childcare?
Yeah, employers should. So when it comes to the FFCRA and the time off needed for childcare and PTO policies, your employer should have all of that for you and readily available for you. In particular with maybe your medical benefits or an EAP program like we spoke about, your employer will have all of that.
What I think to add on, it is public record, right? There's an enormous amount of information on the website or on the government's websites about these paid leaves. But to your point, many employers cannot comprehend the ever-changing daily release of new stimulus and paid leave packages that keep rolling out, and they're changing, and some are extending potentially with this HEROES Act that is being worked through right now. So our information is posted on this website. If you are an employer, or you maybe want to help your employer understand that you've heard about this, we are happy to answer those questions or provide. If you want us to send you, we have quite a few handouts that outline those different criteria that you saw today in the slides, but in much more in-depth information. Happy to share that with you as well. So I went back to the slide that has both Danielle and I's email. Do not hesitate to reach out to us, and we can get you some of that, as well as we are conducting additional trainings that do a much more deep dive into those paid leaves. And so those would be webinars that are going to really get into how to process them, how to obtain those credits, and how to properly pay people if they qualify for those leaves. It's it is a very thorough and complex process that it's an amazing benefit that's been extended, but it's also very, very difficult for the average business owner to now become an expert at that. So we do have that information. We are processing, I think we're tracking over $40,000 monthly in credits that we're issuing through our payroll platform. So it is working, it is there, but you do need quite a bit of information if you have a worker that this needs to apply to. I believe we are right at 11 o'clock. So thank you all for joining us today. Catherine, did you have anything else to add? It looks like she's doing the chat, but we do look forward to seeing all of you next week on the webinar. So don't forget to register so you have that link and get it on your calendar. Thank you so much. Have a great day, everyone.